Hello, my name is Stuart Grant, and I've got the pleasure today to interview Brian Ilfeld, who is a Gaston Labat awardee in 2022 this year. I was in the audience as Brian received his award. This interview is part of an activity that ASRA is doing to celebrate the 100th anniversary of the first American Society of Regional Anesthesia, hosted in 1923 by Gaston Labat and his colleagues. And although the modern day AZRA is not real, AZRA in pain medicine is not related to the original organization, we're really, we wouldn't exist without the work of Dr. Labat and the original American Society of Regional Anesthesia. So Brian, thank you for spending time and let's interview this evening.
Well, thanks for having me.
I think it's going to be a great archive when this is done, and we're asking folks the same questions, and the one I've led off with every day is, what led you to choose the field of regional anesthesiology?
I think mine was pretty simple, actually. I saw people during my residency who got to the PACU and who had general anesthetic, and then those who had a peripheral nerve block or neuraxial block, and the difference was so unbelievably great that it was just it was impossible to ignore. And so I had the very naive belief that if we could just provide our patients and our surgeons' patients with superb postoperative analgesia for days, if not weeks, then surgeons really would have no choice but to allow us to provide their patients with regional analgesics. And I thought that because even though we could provide single injection nerve blocks at the time of my residency in the late 1990s, surgeons could still request a general anesthetic and they could still perform their surgery under the general anesthetic. But I thought, well, if we could provide excellent post-op analgesia for days and weeks with a regional anesthetic, then the surgeons would surely request that for all of their patients. Fortunately, I can't say that is what exactly has.
So that happened every time since from that point forward.
At certain institutions, it probably has.
My story was very similar. When you started in regional anesthesia, what do you think were the predominant issues at that time, and do any remain today? Or we can maybe talk about what are now your goals. But when you started, what do you think the predominant issues were for regional anesthesia, regional anesthesiologists?
I think extending that analgesia beyond just the first few hours of surgery and after surgery. And so that's really where my interest kicked in, the continuous peripheral nerve blocks and their use in the ambulatory environment. And I think that really was a huge issue in the early 2000s. And then, of course, in the later 2000s, ultrasound, and that was just a sea change. So those two, I would say those two topics, even though they started in the early 2000s, mid 2000s, they're really going on today. And we're still trying to figure out both of those and optimize them both. So even though it's 15, 20 years later, we still have a lot to learn.
Yeah, they say it's like between the research and the clinical practice can be 5 to 10 years. And I still think there's people in practice who are learning these techniques. I completely agree. You mentioned ultrasound. I think that's probably the biggest evolution and change. Anything else you think has changed and how we practice?
Well, the continuous peripheral nerve blocks, I think, are huge, and they're standard use now in the ambulatory environment. That I remember when Kaiser Anaking and I sent our first patients out after a knee arthroplasty with straight from the PACU with 2 continuous peripheral nerve blocks and a couple of portable infusion pumps, and we were just wringing our hands, and our surgeon was with us, wringing our hands and calling the patient 3 times a day. And now it's so standard for us. We wouldn't consider doing it any other way. We've moved so much of our arthroplasty cases from inpatients to the outpatients because of that. And it's just amazing for me now when I think back on just those changes in the last 17 years that I've seen. And ultrasound really has changed continuous peripheral nerve blocks as well, because I think before ultrasound, it was really almost a mystery to people who hadn't done a fellowship or hadn't had a lot of practice with regional in the residencies, because it was hard for residents to get enough volume with nerve stimulation to, I think, become proficient. So people really, if they wanted to practice regional anesthesia after residency, at least in some of the less common blocks, they really needed to do a fellowship. But really what I've seen now with ultrasound, you can learn these techniques in a much less duration of time. And so our residents now are graduating where I was when I finished my fellowship. And then our fellows now are so much ahead of where I was when I finished my fellowship. And that's all because of ultrasound. Mm-hmm. And it really, before ultrasound, we used to walk into a room and everyone would be watching. We do our nerve block with a nerve stimulator. And it almost looked like it was a mystery, almost magic, because they had no idea what was going on underneath the skin. Only the person who was holding the needle had any idea. But with ultrasound, it demystified everything. And now everybody can learn from every single block and see exactly what's going on. And so there's not that mystery and kind of magic, which is a good thing, which means that more people can perform regional anesthetics and more of our patients can benefit from these techniques.
I must admit, when I started using ultrasound, it was a bit of a mystery even when I looked at the screen, if I'm being honest. One of the nurses, she was very astute, had me rumble straight away. She said, "What are you doing? What's this?" I said, "It's an ultrasound. We're imaging." She looked at the screen, then she looked at me and she said, "More like imagining."
Yeah, I like that.
So I think it's, and I think ultrasound has been a great democratizer. I agree there. It's interesting that also I think how the surgical techniques have changed in the time that you have been practicing. There's so much that's done with smaller incisions that allows it sort of marries along ideally with regional anesthesia, get these patients out, get them going, and it's constant change. That's one thing you can guarantee, that there's going to be change in our practice. I'm looking forward to the future. I was lucky enough to be the person that gave you the call as the chair of the Labat committee to tell you that you'd won the award. I was really pleased for you. After the phone went down, you obviously thought, what did he say with a Scottish accent? But what were your thoughts of going through when you received the news you received the Labat Award?
I was incredulous. I was completely incredulous. When you told me, I think the first 17 things I said was, "Are you sure? Are you kidding? Really?" And then I just felt incredibly honored. I mean, to think about the people who were honored with that award came before me. It was just incredible that I'm even on a list with them. So,
I think I know the answer to this when we ask you this question, and I've got an answer for what I think you have done for the field. But I was going to ask you, what changes in thinking or practice or perspective have you fostered during your career?
I think one is thinking beyond the operating room and beyond the PACU. And when I started my residency in 1997, that was really where our practice ended. When that patient departed from the recovery room, they were out of sight, out of mind for us, unless we were consulted for some reason, which was rare. And that's completely changed now, I think. And once our patients, always our patients. And now at this point, at least in my institution, we have far more communication and exposure to our patients after they go home than the surgeons do. Patients call us, and they have a question. A lot of things we can't answer, like when's their physical therapy appointment? I don't know, but they have my phone number, but they don't have the surgeon's number. So I think that's a sea change in thinking. Mm-hmm. And I think that something's now just starting to evolve is thinking beyond local anesthetics. Things like cryoneurolysis, they've certainly been used in the past, no question, but they've been anything but mainstream. Percutaneous peripheral nerve stimulation. These alternative techniques, I'll call them alternative to local anesthetics, I think are going to be investigated in the next 10 years, and we'll really see if and where they have a place. Mm-hmm. And they really are, a lot of people think of local anesthetics as synonymous with regional anesthetic, but there's no reason that cryoneurolysis is any less of a regional analgesic or anesthetic than local anesthetic. And so I think that's a sea change that might happen in the next decade, depending on what we find.
Yeah, fantastic. Who would you consider your greatest mentors?
Oh, I think my first greatest mentor was my grandfather, who was an orthopedic surgeon in academics for 50 years. And I think he passed me along to Kaiser Anakin, who was my mentor during my fellowship. And she taught me everything that I knew about regional anesthetics, analgesics, and research. And she really encouraged me to I was so interested in research that she encouraged me to get a master's in clinical investigation. And I think Dan Sessler from the Cleveland Clinic picked it up from there. He really mentored me during my NIH mentored research grant award for 5 years, where I really learned how to run and develop multi-center clinical trials, which is my great love. And then I'd say that Ed Mariano really is a mentor as well. Ed taught me how to run a team. And I've never met anybody who runs a team better than Ed. And so I learned a tremendous amount from him while he was at UC San Diego. And then I'd say in the last 10 years, Jim Eisenach, Stephen Cohen, and so many other people who really have taught me about funded research and doing research, not doing it all myself, but learning to let go and to trust others doing a lot of the work. And that actually was a hard thing for me to do, because I was so used to doing everything myself. And they really have taught me so much about the entire research endeavor from conception to completion.
That's quite a list of names. You're very lucky to have met and work with those folks, can I say? That is quite a phenomenal list.
And I actually don't want to quite stop there. I would say Joe Neal is the mentor from beginning to end, because I met Joe right when I started my residency, say my first ASRA meeting in 1998 spring. And Joe mentored me to this day. And I call him once every 3 or 4 months with some big question. He always has a great answer for me. And he has always been an incredible source of support.
Phenomenal, phenomenal. What words would you choose to define or describe ASRA?
I think the first is personal for me. They're my professional family. And I've known people like yourself for so long that it's just incredible sometimes. We sit down to dinner at AZRA and just talk about the old times, which now are decades ago. That's exceptional. And when you have a relationship with people over decades, they really become your family. And their losses become your losses, and their successes, really, you just feel such joy for them. And I think that the other word that comes to mind with ASRA is support. When I think about my career, none of it could have happened without ASRA. And when I accepted the Labat Award, and my last slide was a picture of the ASRA newsletter, and it had about maybe 100 pictures of ASRA members on it. And I was going to circle all the people who had really had a profound effect on my career. And everything was circled. It was just one mass of yellow circles. I just had to take the circles off, because basically it was all of ASRA that had this profound effect on my career. And Joe's just a perfect example of that, but so many other people as well. And so I think that ASRA really is my professional family, and I think ASRA is a different association from many. I'm not a part of many others, but I've heard very negative things, a lot of competition and a lot of politics. And I have not experienced that at all with ASRA. ASRA has been just a huge amount of support for me and those around me.
And I think a lot of people love the time that you spend. I see you talking to other people and supporting others, and I think a lot of people really appreciate the time you spend with them at ASRA as well. I've come to the end of our questions. I just want to say thank you for spending the time, and look forward to seeing you at the next ASRA meeting.
Same here. Thank you, Stuart.